So can I call everybody to order, if I may, and can I just say welcome to Moorfields Eye Hospital Annual General Meeting. And for those that don't know me, my name is Professor Tim Briggs, and I'm the interim chair at Moorfields, and I've been in post since April. And so this is my first AGM that I'm chairing today. We're joined by our board, as well as the membership council, including Rob Jones, who's the lead governor, and deputy chair, Alan McCarthy, and clearly a number of members of the staff are present with us today. But can I just extend a really warm welcome to everybody here today, and your presence is very much appreciated. So before I start, I've got to do these house rules, if you can look at the screen. So it's going to be streamed, and that's one of the reasons I was sitting down, because we've got a camera here, and if we were standing, you wouldn't be able to see us. Could we just try and keep the noise to a minimum in the canteen, as it'll be more difficult for those online to hear what's being said, and just please keep your phones on silent. If you're online and you don't want to be seen, please just turn your camera off, and we're not expecting a fire alarm drill anytime soon. So if it goes off, we've got to leave the building. And after the main presentations, there'll be an opportunity for you to ask questions. And before it's opened up to the audience here in the room, we'll be answering questions submitted in advance of the AGM. And if you're asking a question, please, you'll be asked your name, and if you're a patient, staff member or stakeholder. Okay, thank you very much indeed. So can I have the next slide, please? Lovely. So what is great for me is that this afternoon we'll be hearing a review of the governor activity during the year for the Vice Chair, Alan McCarthy, who's the Vice Chair of our Membership Council. And then that'll be followed by highlights of the year in performance by our interim CEO, Peter Ridley, and followed by financial operation review by Arthur Vaughan, our Chief Financial Officer. And that'll be followed by Sheila Adams, our Chief Nurse, who's going to give an update on quality and safety, education and performance. And then, as I said, there'll be an opportunity to ask questions, and we'll start with those that are being submitted in advance. But please, as I said before, if you're asking a question, please say your name, explain in what capacity you are here today. And when we've answered the questions, we'll have a few closing remarks, and then we'll close the formal part of the meeting. So if we get going, to start proceedings, we need to approve the minutes from last year, which have been posted on our website. I am aware that Rob Jones is proposing we accept the minutes of the AGM from last year, and Paul Murphy is seconding those. Can we approve the minutes? Everybody happy? Okay, we've approved. I think it's important that I draw your attention to two other records of the year: our 2024-25 annual report and the accompanying quality report. Again, they're on our website. They are both equally important. I would encourage you, if you haven't, to read them, what we've achieved and how we've done it. And there is some really, within it, there's a real flavour of the range of extraordinary clinical care that we offer, and how the whole organisation is focused around delivering really safe and effective, and as I said, really high quality care. So if you look at this slide here, this is a history of Moorfields. It was actually founded in 1805, and it has now developed into, I think, the top eye hospital in the world. And clearly the history of Moorfields and its richness about delivering the best treatment of care is still our top priority today. I'm pleased to give you an overview of the past year, where we have been able to showcase our achievements as a trust, and that's down to everybody in the organisation, and the staff critical to this. And I think that has been recognised by the NHS, where Moorfields is the #1 hospital in the NHS in the league tables, and that is a fantastic achievement, and it's down to everybody who works in this organisation. People may or may not be aware there's been some leadership challenges this year, and I'd like to thank everybody who's contributed to ensuring that the organisation ongoing stability during this time of change. I've now been in post for 6 months. I'm still a practicing clinician, and I have been really struck by the standards, innovative way staff go about their care and deliver time and again above and beyond. And I was very privileged to attend the first Moorfields Star event in my capacity as chair in September, where I saw firsthand with the awards that were given out the fantastic work of our people and what working at Moorfields really means to those. This annual general meeting is going to highlight some of the great achievements accomplished over the last year. And I have to say again, without the staff here and their commitment, none of this would be possible. And without them, we would not be in the position we are today. So highlights, I think, are the key transformation project called More Connect, which is our new EPR. And getting that right is absolutely critical as we move into our advanced care centre, currently known as Oriel, where we're going to move in 2027. We want to make sure, and we are, that Moorfields is an equitable and inclusive organisation to work, all part of our commitment to learning and evolving as an organisation. I know I banged on about it, but staff is critical, and without staff, you won't have success. And again, I want to thank every member of staff in this organisation who all contribute to the exceptional care we provide for our patients. So on behalf of the board, I'd like to thank everybody for their dedication and hard work. And together, that's what makes Moorfields. Now I'd like to hand over to Alan for a review of the governor's activity. Alan.
Thank you very much, Chairman, or may I call you Tim?
Absolutely.
Good afternoon, ladies and gentlemen. Again, it is my privilege and my pleasure to give you an overview of the work of Moorfields Membership Council over the past year. Moorfields governors have had another active year that have worked throughout with the non-executive directors and, where appropriate, the executive team to engage and seek assurance on behalf of our membership. Elections took place earlier this year for some public and staff governors, and I am very pleased to introduce and congratulate all of those elected for a 3-year term of office. These include public governors Emmanuel Ziridis, John Russell, John Sloper, Margaret Connor and Kimberly Jackson, and staff governors John Schubacher and Bakari Folasade. And I hope I pronounced people's names correctly. I was also re-elected for another 3-year term. I would like to say thank you to those who stood down from the Membership Council during the year. Andrew Clark, Joy Adesanya and Anup Shah. Each was a valuable member of the council, and I hope that they are able to continue to support the trust where they can. Governors met as the Membership Council both at meetings in public and others in private, a total of 7 times during the year. Additionally, there were a number of meetings of its subcommittees and its subgroups. I'll give you some details. The Governor's Remuneration and Nominations Committee is a committee that is responsible for the selection and appointment process for non-executive directors, including the Trust Chair, and ensures that the process is robust. The committee also reviews the performance of the Chair and non-exec directors and reviews remuneration levels for them to ensure appropriate balance between value for money and attracting candidates of high calibre. In 2024/25, on the recommendation of that committee, the Membership Council reappointed the following non-executive directors. Ros Gibbon-Wilson for 3 months to assist with handover as she left the Trust after over 9 years of service as a non-executive director, and Adrian Morris for a second 3-year term, and who became the senior independent director after Ros retired. We also appointed 2 new non-exec directors to replace Ros and Nick Hardy. They are Michael Marsh and Elena Loctava, and we welcome them to the Trust, and we already enjoy working with them. The Membership Council also appointed the interim chair, Professor Tim Briggs. As stated, we said farewell to Ros Gibbon Wilson and Nick Hardy, and we also farewelled, if that's a verb, Richard Holmes, who stepped down midway through his term due to personal reasons. We are actively recruiting to his role. We thank all of them for their wonderful contribution to the board and wider hospital community. Regarding the work of the governance subgroup, the governance development group proposes and carries out initiatives that will improve the role of the Membership Council in the development of governance individually and collectively. This year's governance continued to focus on governor visits throughout the Trust, sessions with governors and non-executive directors to further understand their work, developing a governor buddy system for new governors, arrangements for Members' Week, and develop further training for governors. Among other activities, the group plans this current year to oversee a review of the Trust Constitution with other governors and colleagues. The Members and Patient Engagement Group focuses on initiatives of how best to communicate and engage with members and patients. The group helped produce a welcome letter from the chairman to potential new members. They continued to focus on membership engagement and patient experiences through the year. They received update on the membership database and had input into patient communications and the newsletter. In the current year, they will focus on developing a new membership engagement strategy. May I take this opportunity to thank my friend and colleague Rob Jones for his work as lead governor. Indeed, may I thank all of the governors during this year and the staff who assist the council for all their work and time given to supporting the important work we carry out in our groups and our council, which ultimately is to the benefit of our patients and their families. And we are very fortunate indeed with the people that we have. Governors have taken part in a number of different activities, including further engagement on the Orient journey, particularly as this shifts from focusing on the building works to how patients and staff will use the building. We also continue to work with board colleagues to ensure the patient voice is heard throughout the implementation of our EPR project, Electronic Patient Records, if you prefer the 2 acronyms. The council also appointed the external auditors for another year. During the year, we fed back and discussed the board meetings we had observed and commented on the Trust annual plan and annual report and accounts. We also assisted with the successful running of another Members' Week. The council worked hard during the period of change at board level with our then chief executive away on extended leave and who later resigned, and the resignation of our chair, Laura Wade-Gearing. I want to take this opportunity to thank them both for their contribution to the Trust. In response to a letter from the chair of the Consultant Committee, the governors have commissioned 2 reviews into board governance, effectiveness and culture, as well as responding to the issues raised in the letter. These reviews are proving to be very complex and are not likely to report until December. However, the governors and trust are committed to both reviews handing down thorough reports. It will be worth the additional time to complete these important reviews. The Membership Council continues to have a positive and constructive relationship with the Board of Directors and keeps up to date through briefings about the work of the board's subcommittees and with regular contact with non-executive and executive board members. This means that governors are able to fulfil their duty to hold non-executive directors to account for the performance of the board. I would like to take this opportunity on behalf of the whole Membership Council to thank all staff and the volunteers associated with the hospital in achieving the #1 place in the first NHS National Outcomes Framework League table. The work of all those people together makes that happen, and it's really very pleasing to be able to say thank you to them all. I would like to thank our interim chair, board and staff of the Trust for the continuing positive and productive working arrangements, and to thank warmly all of my colleague governors for their contributions. I am pleased to conclude today by confirming the governor's sincere appreciation to the board and Trust staff for their continued dedication and commitment to providing an excellent, high-quality service for our patients and carers. Thank you, Chair.
Thank you. Hand over to you.
You can, yeah. No, thank you, Alan. Thank you, Tim. Hi, everyone. My name's Peter Ridley. I'm the interim chief executive. Sam, can you hear me at the back? So in the room, good. We've tested out the canteen for this purpose, but just flag if we're getting a bit quiet. So I've been here around 9 months now, having worked in the NHS for about 26 years, and I feel a real privilege to work at Moorfields and build on some of the history that Tim has described. It's an institution, frankly, that I know how important it is to our staff. I know how important it is to our patients and to many of you in the room. And I really feel that going around the organisation, the pride people have got in this organisation and the importance of what Moorfields does. What we're going to do is we're going to review 24-25, so the year that finished at the end of March. I'll take you through some of that. I'll ask Arthur to talk a bit about the finances and our performance, and then Sheila will talk about some of the other aspects of what we've achieved in 24-25. So if I can go to the next slide. I think it's always worth starting, isn't it, by reminding ourselves why we're here and why we're here as Moorfields. So fundamentally, it keeps coming back to that first bullet point on that slide, that people's sight matters. And that continues to guide what we do. We recognise and understand that sight loss is one of the most feared medical conditions that people can experience and people worry about, and we have a real responsibility and take that very seriously as what we do. Across the country and in London, people still suffer avoidable sight loss, so we are still here to do what we were set up to do all those years ago, and we'll continue to take on that mission. We have more people here trying to prevent sight loss than anyone else has. And so we also see our duty to share that learning and research as widely as possible, and that is what we have continued to do. In England and indeed worldwide, health services we know are generally struggling with ageing populations, increasing levels of diabetes, increasing numbers of conditions that our patients have, and that particularly impacts ophthalmology, which is already the biggest outpatient specialty in the NHS. So we think we've still got a job of work to do and will have for many years to come. Our purpose and our values will remain our guiding light in all of this. So our purpose is to work together to discover, develop and deliver excellent eye care sustainably at scale, and in doing so with the values of excellence, equity and kindness. Moorfields has long been recognised as a global centre for excellence in eye care, research and in education. And we also need to be equally excellent as a place to work and a place for patients to experience that care. It's not just what we do that's important, it's how we do it, it's the patient experience in that, and it's how our staff feel when they're at work will be important to us. That's why our two other values of treating everyone equitably and showing kindness to both patients and to our colleagues is important to us. So we'll go into a few of our achievements this year, but to pick out some of the big three things kind of three of our big programs of work we've got going on at the moment. So our new centre that we are currently building in Camden, and those that have been past there recently will see actually a real shape of what that centre looks like now. That reached its maximum height, so our topping out, as we call it, in December 2024. And we're now doing lots of work to fit out that building. So a really exciting project I'll talk about a little more in a moment. As Tim mentioned, we signed the contract for our new electronic patient record, a really important stop for us and really important stage for us. And we're working on the implementation of that. And we've also at the same time developed, launched and embedded our single point of access for ophthalmology referrals in North Central London, and doing that indeed beyond some parts of North Central London. That is one place where referrals can come, where we can understand and help patients make the choice that is right for them, and try and make sure that patients get to the right service first time. So to really help patients navigate the NHS, which isn't always easy, and to be that real link to GPs and to optometrists. So 3 really important things there. If I take you through our purpose, the first place we'll start with is working together. And this review is structured around each of those purposes. So we're in a period of great change within the NHS, it feels like within the nation as a whole, indeed internationally. And with a new government and a new 10-year plan for the NHS, we're seeking to make sure that we deliver on the opportunities we have, and we meet the challenges of those great changes. We certainly can't achieve excellence alone. So we work in partnership with a whole range of organisations, includes UCL, the Institute of Ophthalmology we have just next door. That's National Institute of Health and Care Research, who are massive supporters of us and provide much needed funding for research. NHS Partners, which includes NHS England, but all the other providers of care in London. Our Integrated Care Board, local councils, the voluntary sector. The list goes on of the people that we need to work in with partnerships to deliver excellence. I'd also particularly at this point like to mention our incredibly generous Moorfields Eye charity. That helps us do more than we could possibly do alone. And indeed the Friends of Moorfields, who provide so much service and so much support within the organisation every day. As Tim has said, our staff and those that work here are our key resource. Every individual contributes to Moorfields fulfilling its purpose. And whether that's those developing those new groundbreaking treatments that we'll talk a little bit about, those delivering consistently high standards of care to our patients, those supporting those individuals to make sure that we can deliver those services. Everyone is part of delivering for Moorfields and fulfilling that purpose. And we continue to work with them to deliver ever more efficiently, at ever quicker pace, because that is the world we live in, and also trying to deliver the highest quality service that you all should expect from us. One of the things we wanted to highlight in the presentation this year was a core part of working together is tackling equality, diversity and inclusion in the organisation. And that is for the organisation, both in terms of our workforce and how we work together, but also in terms of our patients and how we interact with our population. There's a lot of emerging evidence that suggests this EDI programme is really starting to establish a strong foundation. We've got lots more work to do, but we are making steps in fostering a more inclusive and equitable organisational culture, which is really important to us. Key interventions reflect a shift from, I guess, historically some slightly ad hoc approaches to EDI to something is much more intentional that we seek to embed and gives us that foundation for success in the future. We've pulled out some examples on the slide here, and we could mention a number. That includes implementation of the NHS England Equality Delivery System. So that is it's a framework from NHS England nationally about how we about the standards we should set and what we should do as an organisation. We've had the introduction of our Share Not Declare campaign with our colleagues in the organisation, and we've also redesigned how we make sure we are doing quality and health impact assessments really well in the organisation, so we know the impact of what decisions we're making in the organisation for our staff, for our populations, and for what we need to deliver. On the next slide, you won't be able to quite read the roadmap we've got, but we have an EDI roadmap now, which has been developed in consultation and frankly with an awful lot of work from a number of people in this organisation. It documents our journey, showing what's happening, what we've got planned across the trust in a really clear and transparent way, so everyone knows what we're trying to achieve and how, and shows how we're moving forward in our journey to ensure diversity is valued and embraced in all its forms. Includes regular updates on over 20 individual projects now, and each with different communication strands and with different people involved in them. We also took a significant step this year towards becoming an anti-racist organisation by signing the Unison Anti-Racism Charter, and recently brought an update on that to board. The supporting delivery programme for that is mapped out in that EDI programme I've described, and we're now on a journey to embed anti-racism into our leadership and training programmes and improving understanding of race-related issues. Is also evidence of emerging reduction in percentage of staff who are experiencing discrimination due to disability. So we're showing we're making some progress in this area. I will still say we've got an awful lot of work to do. And so we certainly won't stop our efforts in this. We're certainly not at a place where we are flagging victory here, but we're showing some signs of moving in the right direction, and we'll continue to put a lot of effort into discrimination in all of its forms. And on the next slide, equally, we're also seeing improvements in staff perceptions of fairness regarding career progression at Moorfields. So that particularly reflects the early impact of our targeted EDI initiatives, such as the career sponsorship program we've got now and the leadership academy program we're running. So recognizing, I will say every time, we still have work to do, but we're seeing the green shoots of that work, and that will encourage us to continue to do that. In terms of other things we've done in working together, our single point of access, which I mentioned briefly, during that year, we've seen the real benefits of that in North Central London and really improving the referrals coming into providers. As a result of that, we got prestigious Health Service Journal Award, which is always nice to get an award. And we got the award for Acute Sector Innovation of the Year, which is fantastic for everyone involved in that project. The partners working together with Moorfields include the Royal Free, includes North Central London Integrated Care Board, local optical community support unit, and NHS England. So a real, again, set of partners coming together to provide a more effective service for our population. Patients benefit from a choice of provider. We consider factors important to them, such as reputation, waiting times, location of the service, and through that single point of access, we can deliver better training to referrers, can increase the quality of those referrals, which fundamentally gets to a point where we improve the quality of the service and the pathway for the patient, and patients being seen more quickly. Also within, it would be remiss of me to say, without our partnership with the charity enables us to do a lot of the things we do. So in partnerships with UCL, the Moorfields Eye Charity, they have raised over £75 million towards our new centre that is being built, an exceptional effort, and enables us to design, deliver, build what will be a state-of-the-art facility. Without that philanthropy, simply wouldn't have been possible. So an enormous thank you to those involved. I know the charity are incredibly proud of the community of dedicated supporters and donors they have, and we equally would like to thank all of those people who've made this possible. If I move on to the next theme within our purpose, which is discovery, and discovery is at the heart of everything we do as an organisation, as Moorfields, and 24-25 was no exception to that. We made several breakthroughs during the year, and I just wanted to share just some of them with you. So our groundbreaking work on a gene therapy for LCA4, which is a congenital disease. It's a really rare genetic eye condition that causes blindness from early childhood. We saw remarkable results from the work there. All 4 children in that trial retained or improved vision in the eye that was treated, which wasn't the case in those in the eyes that weren't treated. So a real breakthrough there that we will seek to build on. Had loads of important work in artificial intelligence, or AI, and showed the value of using the pigmentation in retinal scans as determinant of ethnicity rather than self-declared nationality. So some real breakthroughs there. And also markers in the blood that predict whether glaucoma patients are at a higher risk of continued loss of vision following conventional treatment have been identified in another study. So really, again, continuing to push the boundaries as an organisation. Really active in research, as we have been for a number of years. So 159 live studies in the year, of which 57 were non-commercial. Recruited over 5,000 patients to participate in clinical trials, and our Rome database, an online tool to support recruitment into trials, now has 3,743 patients. So really healthy in research. In terms of discovery, Moorfields Eye Charity awarded over 90 grants in the year, totaling almost £20 million. And not only did the charity fund discovery research and cutting-edge innovation, their support has led to improvements in patient experience, in some staff wellbeing schemes, and has helped support us to train and deliver developments for our staff. So I just want to say thank you to all the patients, carers and staff who made that possible. The support is making a real and tangible difference. So I will say thank you a lot. Next theme is develop. So we know that research is important, but isn't an end in of itself. So we work really hard to make sure those discoveries are made available for our patients from across the NHS and indeed beyond the NHS. We also develop the way in which we deliver our clinical services, our physical and digital networks, and our operational systems to make sure we continue reliably excellent eye care and provide that consistently. An obvious example of that we continue to work on in the last year is Oriel, our new building. Lots of great work gone into that around the wayfinding, so how people find their way to the building and then how people find their way around the building. So a really successful transport survey for patients to input into how we develop that strategy, and more than 500 patients responded to that survey and have helped us develop what that should look like. I've already said we had the topping out ceremony in December 24, so when we reached the top height of that building, the interior design really progressed in year, and indeed now we've got to the point where most of that design is complete within the building, and that is being built as we speak. And again, philanthropy being a real core to that. So some thank yous there to Schroeder Foundation and family, friends of Moorfields, but also many, many other donors that have made this possible. We have mentioned a little bit our new electronic patient record, which we call More Connect. It's been a really exciting year for the progress in making that a reality. So we've signed the contract. We have our provider partner there who are called Meditech. We've established our team and the governance around implementation of that electronic patient record. And that identity More Connect was created and launched really to demonstrate to our organisation what we're trying to achieve for electronic patient record. It's digitising records, it's helping connect data more effectively and helping us to provide a more effective and efficient service. Work's been undertaken on our EPI blueprint and what the first prototype of the system will look like. We are now following a process of prototypes, refining the design, and by the end of March 25, prototype 1 was nearly complete, and indeed we've moved beyond that now. If we then move into discovering and development are important, but delivering, of course, is really important for our patients here and now. And behind that purpose that people's sight matters. So this section, we're going to cover the finances for the year. We'll talk a little bit about our operational performance and patients' access to our care, as well as a couple of illustrations of the way we deliver our services in line with those values of equity, of kindness, as well as excellence. So a couple of things from me, and then I'll hand over to Arthur. So just to reflect on, we deliver services now well beyond the boundaries of England or indeed the UK, and have done for some time. So Moorfields Dubai has been open for 18 years now. It's seen over 385,000 patients and performed 32,000 surgeries. Abu Dhabi, our unit in Abu Dhabi, has now been open for 10 years and seen an awful lot of patients as well. Both branches are fully accredited, have international accreditation. And in 2025, Moorfields Dubai became the first hospital in the Middle East to achieve it's the Australian Council of Healthcare Standards Centre of Excellence accreditation, a really big piece of accreditation, internationally recognised, and the first centre in Dubai to achieve that. So fantastic services out in the Middle East, which we're really proud of. Equally, our private care practice is important to us, 5th largest in the NHS now, providing private patient care in the UK. And in 2024, we completed over 48,000 outpatient appointments, over 5,000 surgeries, and over 1,000 laser procedures. Moorfields Private invests time and resource in building relationship with our optometrists, private GPs, international health offices to increase the referrals. And what's really important to say is both the work we do in the Middle East and also the work we do in private practice, those financial services are incredibly important for us to reinvest in NHS service and again, make a significant difference for the patients here that we treat in London. In terms of recognition, we've had a really successful year in terms of the recognition a number of our staff have received, international awards, real recognition of the fantastic work they do. And this slide could have been as long as we wanted it to be. So we've picked out some individuals here, but this year, 10 of our clinicians were recognised in the Ophthalmologist Power List, as it's called. It represented a staggering 20% of people recognised worldwide in that shortened list this year. So 20% of the people in that international list are from Moorfields. We're really proud to say that Shobha Sivaprasad, one of the 10, was also honoured by the Macular Society and the Asia Pacific Vitreoretinal Society. and indeed received a significant award at our STARS ceremony this year. Ken Pullum, Principal Optometrist, was awarded the Frank Pettigrew Award for Contact Lens Research in Optometry by the College of Optometrists. Flosie Donovan, our play specialist, won Charity Starlight's Mentor of the Year 2024 award. Dr. Roxanne Crosby-Nwobi, Lead Nurse for Research, has been awarded a fellowship by the Royal College of Nursing. And there are many, many more honours in the organisation. I could mention many of them. Just gives you a flavour of the individual achievements we've got and that recognition of the great work many, many people in this organisation are doing. Finally, a really good year for media coverage as well, for really getting the message out of what we do in Moorfields. And thank you to our communications team and others for that. It's fantastic to get the stories out there. Our top media during the year was the biggest breakthrough. The gene therapy LCA4 I've talked about was our biggest story of the year. We also welcomed Nigar Arif and ITV's This Morning to showcase our cataract surgery during the year. They were able to film a before and after set of interviews with our surgeon Chris Leake and a patient who'd lost his sight due to rapid onset cataracts. And by the end of the programme, he could see again. It was a fantastic piece of the real before and after, the difference that we make for patients, and was fantastic to be able to broadcast that much more widely. So a really successful year. I'm delighted with all the achievements and what we've been putting in place for the future as well as for delivering now. We know we've got lots more work to do. We certainly won't rest on our laurels, but I'm really proud to describe some of the achievements that I have. What I'd like to do now is hand over to Arthur Vaughan, our Chief Finance Officer, who's going to give you a summary of our financial and operational performance results.
Right, so everyone will know that the NHS is a really financially challenged area at the moment, but Moorfields achieved its plan last year, so a £19.8 million deficit. When you adjust for all the accounting wonders, that's a £4.3 million surplus, which is £4 million better than our plan. And we did that whilst also absorbing 5% growth, which we'll talk about. Our income increased in line with inflation. We had a bit of growth, but not a huge amount. And we also benefited from legislation and other operating income includes charitable funds, R&D, etc. So that was a really positive news for the trust. If we move on. So we did that whilst doing 5% extra activity. So we're now over £750,000 of appointments, which I think is quite an achievement for the trust. And if we look at the performance on the next slide, you can see that we're now back to pre-pandemic levels. So all the innovations that we've done around virtual hospital, etc., is starting to pay off in terms of seeing patients close to the community at the same levels, which is really good. And in terms of targets, so 98% of A&E seen within 4 hours, all 4 of our cancer targets met, and 83% of our RTT within 18 weeks, which is in the top 10 in the country. So we're achieving all of this growth whilst also achieving the access targets set out. Well, not all of them achieved, but good achievement. So if I hand over to Sheila.
Good afternoon, everyone. I'm Sheila Adam. I'm Chief Nurse and Director of Allied Professionals here at Moorfields. I'm going to talk about quality, and all that Arthur has spoken about would not mean a great deal if we couldn't also report to you how well we have done in the quality domain. And I'm going to talk about the 3 dimensions. So that's patient safety, clinical effectiveness, and of course, patient experience. So on the patient safety side, we implemented something called the Patient Safety Incident Response Framework. This is a new national approach to learning from any kind of incident that's occurred and to gathering up that learning and using it to really make a difference in terms of how we deliver care. It's a cultural shift and it's taken quite a while to get rolling, but it has now started, and we are supporting patients and staff following any event and developing really meaningful actions that will lead to sustainable improvements. As a part of this, we've also adopted shared decision making. That's an opportunity for all our staff to come together and look at where they feel they can make a positive change in their part of the organisation. It also means their voices can be heard. For clinical effectiveness, we have performed very strongly against the 28 clinical outcomes that are appropriate for Moorfields. And these include things like reductions in the complication rate for cataracts and continued reductions in the infection rates for those requiring regular eye injections. We have an amazingly low level of infection in this group. We've also continued to see a trend of increased success in retinal detachment surgery, and with plans moving ahead for a nurse-led longer-term follow-up to ensure that initial success rates continue. On the patient experience side, we've made improvements in patient transport, and we've focused particularly on making sure that the certificate of visual impairment processing times are improved so that everyone who wants and needs a certificate will have them in a timely way. We've made progress as well in implementing the accessible information standard across all of our communications. These are all vital items for our patients. And in wider quality work, we've celebrated Safer September, something we've done 4 times over the last few years. This is a month of focused activities to reinforce that quality is central to all we do. We do executive walkabouts, we have weekly focus areas, and we have targeted information gathering to drive future quality improvement across the whole of the trust. I'm now going to move on to education. This is the next slide, thank you. But education is also a cornerstone of how we deliver what we deliver here at Moorfields. And I want to say it's been a hugely successful year for Moorfields education. Overall, we have offered places for over 1,000 medical students and 44 physician associate students. These are short placements, but they're hugely important in the development of our next generation of doctors. There were 163 pre-registration undergraduate student nurses and 16 apprentice nurses in training over the year, and 9 nurses during that year actually achieved registration with the NMC. For orthoptics, we have a number of short one-day placements. We have 6 4-week placements and 5 pre-reg orthoptic students. And overall, optometry provides pre-registration opportunities for 4 trainees. We also cover trainee pharmacists and pharmacy technicians. And finally, our group, a huge group of staff who are hugely important, of ophthalmic technicians. We have offered OBS 3 and 4 imaging courses to a vast number of ophthalmic technicians overall. And 4 healthcare scientist trainees were supported. So a huge number of multi-professional trainees that have continued. Postgraduate education courses for non-medical staff have been supported by our continuing professional development funds and our income from some commercial courses, which I'll also mention. This you might want to go on, thank you. The commercial education, these are courses, very specialist courses that we develop here at Moorfields and then offer to national and international students across the piece. They book in and receive highly specialist and highly effective training. It's been a very strong year for this, and we've achieved over £800,000 worth of course income from developing these courses. It's hugely impressive and produced a 50% increase overall. There have been over 1,500 attendees on our courses. Finally, it's my great privilege to just mention our Moorfields friends. And I know that Angela and Tim are in the audience. And as always, it's a delight to talk, however briefly, and on their behalf. The Friends of Moorfields currently have 327 active volunteers. They provide over 1,000 volunteer hours per week, plus another 242 potential volunteers are going through the onboarding process at the moment, which is a phenomenal amount. In total, our volunteers provide the equivalent of 40 full-time staff posts. And even if they were paid at the lowest level of our Agenda for Change pay bands, their value to the organisation would be around £1 million, which again is a phenomenal thing. We have a patient information hub. Some of you may have seen it in the ground floor of City Road, and this has supported over 4,000 patient inquiries, a phenomenal number. And finally, the charity received a high commendation in the Charity Awards 2025 for the hand-holding service. So again, we are truly privileged and blessed to have the Friends of Moorfields working with us. Thank you.
So thank you, Sheila. Final slide on this. So we've told you about all the things we are proud of, all of the things we are working on, but actually we wanted to use this last slide to it's actually what our patients say about us that is more important. And I will read out some of what our patients have said. And just to take some of those quotes, I don't know where I'd be in this very blurry world without Moorfields. The impact Moorfields has had on my life cannot be overstated. They've saved the sight in both my right and left eyes. From my time working in the NHS, I know what good looks like, and my experience is really stunning, excellent. And your care has been life-changing for me. Thank you. So we will continue to make a difference. We'll continue to work on all of the themes we've described here today. We'll continue to strive to be better and do more. And thank you very much for your attention during our opportunity to tell you about some of that.
So, Peter, thank you very much indeed, and thanks to all the panel, please. I thought it was a fantastic oversight of what we actually get up to here at Moorfields. So we're going to have some questions now, and we asked for questions in advance, including from all those attending online. So we'll answer those first before we take any questions from the hall. So where are our questions? There are no questions in advance. Wow. All stunned by the performance. Okay, so are there any questions in the hall? Questions or indeed comments? All blown away by the presentation. Yeah, would you please?
One question would be, your question, maybe a suggestion. Yeah, I think, when the gentleman was talking about research-wise, is obviously is well known, which does do some really excellent research on health anyway. I was wondering, so with currently, whichever, or how many sort of research papers and such and research literature has been related by your model, and that's what will be published. I think it would be a good idea to maybe put that up on either on the website or even be accessible, basically, because for some, let's say for some patients like myself, who like to really know about my and that sort of thing, and any sort of new research that could be possible. I don't know whether that would be. I don't know what your thoughts about that are.
Good idea.
Yeah.
Oh, sorry. Yes. So if anyone couldn't hear that, the comment was a really helpful one around the sheer amount of research and publications we have as an organisation. Could we find a way of making that more easily available to our patients is what we're talking about, isn't it? Which I think is a really good idea. We're really proud of all of that research, and actually it could only be helpful if we make it available to people, make that easy to access, and kind of, yeah, help wayfind a bit to that work as well. So we'll definitely take that away. Thank you for the suggestion. Yeah.
Okay, any other questions, comments? Okay, so all that remains for me to say is thank you for being part of this AGM, whether you're here in person or attending online. And from a chair's point of view, it's been a privilege to do the first 6 months and now continue this. And I've been blown away as a practicing clinician in also a specialist hospital where we were number 2 behind Moorfields, but I feel very privileged to do that. I've been blown away by the standards, the commitment, the research, education. It really is a fantastic world-class organisation. So please, the presentation will be There's a recording of the AGM. It'll be posted on the Moorfields website in the coming days, and please encourage other people to look at it and listen to it. Oh, we've got a question. A hand's up.
Have we got the technology to? Oh yes.
Yes.
Go for it, Paul.
Hi, I hope you can hear me okay. Just to say thank you very much for the presentations. They're really, really good. Very interesting, even for us guys who should know most of the stuff in it. They're very interesting. Thanks very much indeed. And thank you for all your hard work. And thank you. I don't know if it's public yet, that you might be hanging around for a bit longer. That'd be really great. And just alluding to that, are you happy with the succession planning in place? We've had a lot of churn in senior management this year and a few issues. Are you happy with the pace of the plans in place for succession management and what we're doing next in terms of senior executives?
Yeah, thank you, Paul. That's Paul Murphy, who's one of our governors. The question, I'm not sure if people could hear at the back of the room. The question was around, there's been some churn in the team. Are we happy with our succession planning and making sure we fill those leadership posts? I think was about it, wasn't it, Paul? So I guess it's, yeah, we've got some new people some new executives on the board this year. I think they're settling in really well. We still have some posts to fill here, so we will be coming out to advert around our Director of Discovery, which leads our research programme. So Hilary moved on to quite a big job in NHS England during the year, so we'll be looking to fill that post. I'm really sad to say that Sheila will be retiring in the fairly near future as our Chief Nurse and our Director for Allied Professionals. Sheila's brought an enormous amount to this organisation. We'll be really sorry to see her go, but wish her absolutely the very best. We are in the recruitment process, and interviews for that post are in November, and we've got a really strong field, I'm very pleased to say. And we've also been looking, as Paul says, of making sure we've got the depth in the leadership in this organisation. So it's not just about the executives, it's about those in the teams. We've got some incredibly strong deputies. We've been doing a lot of work on the clinical leadership in this organisation and making sure we have clinicians in really key roles in the organisation to help us take things forward. So I think we're in good shape in terms of leadership in the organisation. But actually, frankly, the leadership of the organisation comes from much more than, 8 executives on the board or even the deputies that come there. Leadership in this organisation needs to come from every part of the organisation, from 20 different sites, from 10 different specialty groups within the organisation, our service directors in those groups, our operational managers, our matrons out there at our sites, and those frankly delivering and leading services in each of our sites every day. They are the leaders that really matter in this organisation as well. And so we talked a bit about leadership development programs. We really want to support those people to be able to lead in the organisation at all levels. So thank you for that, Paul. We've definitely got some gaps still to fill, which we are actively working on, but actually we're looking at leadership in the widest possible sense of the word at the moment in the organisation.
Thank you. And with that, I think we'll call the AGM to a close. Thank you.
Fantastic. Thank you.